Donning and doffing of personal protective equipment has been shown to be a key component to not only protecting the provider, but protecting those around the provider and mitigating spread of disease. To that end, we're going to go through both the donning as well as the doffing protocol. We start with the N95 mask. That should be grabbed with an open palm. I suggest putting your fingers through both loops of the straps as such, cupping it with the nose piece over your nose, grabbing the lowest of the straps, flipping it over your head, down to the nape of the neck, and releasing. Then you follow with the upper strap, take that to the crown of the head, and release. Following that, make sure that you have a nice seal up top around the bridge of your nose and down onto the maxilla. Following donning of the N95 mask, we're going to don the eye protection with an additional mask on it. Again, this has a formable nose bridge. Put that over your nose, extend it down over the bottom edge of the N95, grab each of the straps, put it around your ear. Helps if you hold it steady in the middle. And now you've done the N95 with appropriate eye protection. This, as you can see, fits well over your standard eyewear. Next, you're going to don the impermeable isolation gown. I would suggest only doing one tie and doing it in simple traditional shoelace fashion behind the neck so that you can take it off without contaminating yourself at the conclusion of the procedure. I would leave the back of the gown open because the secondary gown will be covering you in the back. These are a size medium gloves. We're going to be double gloved, so I'm going to use a more of a snug fit on the primary layer. It's important for those of us who wear more jewelry. Take off your engagement rings. You don't want things puncturing through your gloves at this point. Next, you're going to put on the semi-permeable surgical gown. You will have your buddy there with you at all these intubations, so it's important to have your buddy step in to help you out. And to that end, I'm going to ask my buddy to come and gown me here. So, Dr. McHugh is going to gown me from the back first, just the top. Okay, and then I'm going to hand him this and do a traditional spin, pull it away from him, and tie myself up. Again, I do this with a simple shoelace tie. Last thing you do is put on your second set of gloves. Personal protective gear is at this point fully donned. 2 gowns, 2 gloves, N95 mask, face mask for eye protection. This is an example of doffing of contaminated, used personal protective equipment. This is likely one of the most important steps that we're going to have in this whole process as it limits self-contamination and spread of the virus. So you start by undoing the simple tie at the side. Grab front part of your chest around the nipple line, forcefully pull forward to release the neck securement, and then fold the gown forward inside out. As you're moving it inside out, remove the gown with the gloves and block while rolling up the gown into a ball. Once you get to the gloves, pull off the outer glove with the gown, leaving only the inner glove with your inner gown. And then dispose of appropriately. Following primary decontamination of the glide scopes that we will be using will not have this basket in it, nor will they have the receptacle for the soiled glide scope stylet. The decontamination includes the entirety of the unit, including the stand that it comes on. Take the glide scope, move it close to the exit of the room. At this point, remove your second set of gloves using your thumb. Take it out. Other thumb to take it off. Throw them out. Remove your second gown. Undo the simple tie. Again, bring it forward in inside-out fashion. As you're taking it off, try to ball it up. These are reusable, remember. Put them in the soiled linen. While still within the confines of the patient room, following removal of the second set of gloves and the second gown, remove your eye protection. Paying close attention not to touch either the plastic eye shield or the face mask. Reach behind your ears, grab the straps, pulling laterally to the side and forward. Deposit in a trash receptacle. Immediately either wash your hands or foam out and exit the room. Following exiting the room, we will remove the N95 mask. Paying close attention not to touch the front part of the mask itself. First, reach behind your head to the nape of the neck. Grab the lower strap, paying close attention to keep your chin up so that you don't contaminate your chest. Pull out and forward and release. The top strap, same thing. Out, forward, and release, keeping your chin up so that you don't contaminate your chest. Drop in an appropriate receptacle, trash can, and immediately either foam out or wash your hands.